Welcome back to Dr. Sellers Educate. We're thrilled that you're back with us. For this snapshot, we're going to be focusing on learning objectives and learning outcomes. Now, this is relevant for those of you that are taking the CNE, the CNE clinical, as well as the novice exam. We know that learning objectives and developing those using evidence-based strategies is a best practice for us as nurse educators. Along with the learning objectives, we also must tie in those learning outcomes. So we're going to talk about the definition of both. But before we jump into the content, I thought this quote by Benjamin Franklin was very appropriate. He states, "You tell me and I forget. You teach me and I remember. You involve me and I learn." The first thing I thought about when I read this quote was Bloom's taxonomy. So I had to make sure that we highlighted the scaffolding that happens as we teach our nursing students, not only to remember, which is the lowest level of Bloom's taxonomy, but also that they learn over time up into the highest level. And this is the cognitive domain that we are showing right now on this slide of Bloom's taxonomy. And we know at the highest level is creating, and some of those verbs are going to be design, assemble, construct, conjecture, develop, formulate, author, investigate. Concept maps are a great example of how students at the level of creation are going to use the knowledge that they have learned over time as they move and progress through the nursing program, and ultimately as we as educators seek to support the transference of knowledge. All right, so definition of learning objectives. Just for purposes of you all going deeper into content, because this is just a snapshot, I want to make sure you do a couple of things right now. First, taking a note of the reference here. We're using McDonald, which is a little different than what we normally use. The reason why I like this reference is because it goes deeper into the definition of learning objectives and learning outcomes, and some excellent examples in this resource. So if you're able to grab it, rent it on Amazon, that would be highly recommended. Or if you are a Jones and Bartlett shop and you have a relationship with the book vendor, go ahead and reach out to them and ask them for a desk copy. So that's one thing I wanted to bring to your attention. That's our primary reference for this snapshot. There is some content, of course, in Billings and Halstead, but I like the way that McDonald's text is written for purposes of us looking at objectives and outcomes. Second thing I want you to go ahead and do right now is to click the subscribe button as well as the bell. That's going to notify you every time there's a new snapshot release. We release one every week here on our channel, Dr. Sellers Educate. And also the third thing I want you to do is head over to our website, our learning management system site, and that is going to be drsellerseducate.com. That's where you're going to find the link to our membership, our bootcamp membership, where we meet every month. And no worries if you're not able to join us live, you will have access to not only the next recording in January, if you're not able to attend the live event, you will also have access to all of the previous recordings, okay, of all of our boot camps. We now have about 6 episodes there posted for you. So go ahead and take advantage of that resource. All right, so those are the housekeeping tips. Now back to the content. Learning objectives are defined as a way for us as educators to be very clear with our students about what they will learn, right? That's what learning objectives are. So these are some important questions that we seek to answer with our students when we design these learning objectives. What will they know at the end of the course? What will they be able to do? And then why? Why is this information important to know? Because there's so much content in a nursing curriculum, we have to think about the must know and need to know versus nice to know, and discern between the two as students progress in the program. There are also 2 different types of objectives. There are specific instructional objectives and there are general objectives. Depending on the specific context of the information that we want to share and the objective that's aligned to that specific content will help us determine whether we should identify specific instructional or general objectives. They both have a place in our nursing curriculum. So let's take a look at one example of a specific learning objective. Within 30 minutes in the learning lab, that's the condition. The student, that's the learner that's identified. The next component of our learning objective is going to be the behavior, which is will obtain, and then the criterion, which is a blood pressure, on a volunteer that's accurate within the 20 millimeters of mercury. All right, so again, for a deeper dive, we're going to see you at our monthly boot camp. And if you're not able to join us, you can always have access by subscribing to the membership. All right, so learning outcomes is going to be the next topic we want to take a look at, because they are different. And we don't want you to get these questions incorrect on the certification exam. You can expect to see content related to learning objectives and learning outcomes, again, across all three of the exams, because it's very pertinent to the didactic environment and the lab and simulation environment, as well as the clinical environment, right? We all must understand the importance and value of developing those solid learning objectives with our students, regardless of our setting, and ultimately what behaviors we're looking at to ensure student learning has happened. That's exactly what outcomes are. They're the tools that we use as faculty to measure mastery of knowledge with our students. We're looking for those behaviors that can really validate that students are competent to practice, right? That's ultimately what we're looking for and what we expect when we talk about learning outcomes. So let's take a look at an example. So here you see an example of a general learning objective. The student will demonstrate performance of a basic nursing procedure. Learning outcomes that could be tied to this specific learning objective is that they will identify the risk of the procedure to the client and then explain the procedure to the client. So students have to understand the why, right? They have to understand the what in order to complete this outcome and to meet the learning objective related to this class. And then as we wrap up, our last bit of content for this snapshot is looking at teacher focus versus learner focus. We know in several of our competencies, both for the CNE novice and the clinical CNE exam, you want to make sure that you are connected and clear about what those learner focus objectives are going to look like, right? We should be transitioning away from those teacher focused learning objectives. And we all know why, because they don't promote high engagement of learning. And that's what we want in order for students to scaffold or move up that scale of knowledge that we looked at when we took a look at Bloom's taxonomy earlier during our snapshot. In order for students to build on their prior knowledge, we must have a strong sense of what the definition or the differences are between teacher focus and learner focus, and then we must make those changes in our curriculum. All right, so let's take a look at an example. So a teacher focused objective would be demonstrate to students how to safely perform Foley catheter removal, versus a learner focused objective is that the student is going to demonstrate safe performance of Foley catheter removal. All right, so think about the action that students are going to perform as a result of this specific objective. It's easy now, as you think about what the difference is between the objective and the outcomes, it's easier to see what that really looks like in that specific example. All right, so now as we wrap up, that was our last bit of content. Now, as always, we want to make sure that you are clear about the answer to this question. So learner focused objectives requires examination of teaching strategies to develop creative methods to facilitate student learning. During a recent exam review, students complained about the difficulty of the exam, with most students failing the exam. That's never good. And express a strong lack of understanding of the complex content. So they felt like the exam was really tough. So what is going to be the best next step that the faculty members should take following the exam review? A is to review exam performance of other students on the exam. B is to schedule a time with each student to discuss concerns individually. C is going to be discuss concerns with lead faculty, and D, review the exam blueprint to determine if there was misalignment with content level. All right, you can pause the video here. All right, so the best answer is going to be D, and let's take a deeper dive in looking at this question. Remember, we've previously talked about oftentimes you're going to see on the CNE and CNE-CL and novice exams what I call a three-part question, right? There's often going to be three parts to many of the questions, not all, but many of the questions that you see. There's going to be a statement or some content, right? So we have a definition of learner focused objectives, and then you're going to see a scenario or some fact or question related to the specific content that was mentioned. So you see here during a recent exam review, that's the scenario or the case, if you will, the case study. And then the last part is going to be the question, right? So what is the question that you are trying to answer? And that is, what is the best next step? Now, the reason why D is chosen is because, first of all, this is following the exam review. We know that item analysis is important. And part of the item analysis process is, you guessed it, making sure that we are developing that exam blueprint. This is going to ensure that there's alignment for the level of knowledge that we expect students to understand. So we always want to ensure that that box is checked when we think about developing that exam blueprint. That's going to ensure that if we have a level 4 student or senior student, that we are including higher level activities and evaluation and assessments of learning versus a student that may be a first-year nursing student. We know that they are often going to be at that lower level remembering phase. Our junior nursing students, that's where they start. All right, so that's the reason why that's the best next step. We did see some other options in looking at exam performance. That's a good idea, but as it relates to students saying that the exam content was very complex, you always want to go back to that exam blueprint. Would we possibly discuss with lead faculty? Certainly that's an opportunity. Do we want to meet with students individually? Sure, of course, if students want to meet with us, that's supporting that student-faculty relationship. But the best next step is going to be for us to take responsibility as faculty to look at that exam blueprint. All right, so we appreciate you all joining us for another snapshot. We hope this has been helpful. Remember to reach out to us at info@𝐷rSellerseducate.com. You can still reach us at 𝐷rSellerseducate@gmail.com as well. Either one is fine, but we're here to support you. We look forward to seeing you at our next boot camp. Again, go ahead if you haven't already and subscribe to our channel. You can also find more information about how to reach us at 𝐷rSellerseducate.com. That is our website. And then there's some other resources for you down in the description if you are on our YouTube channel. Okay, this has been Dr. Sellers Educate. We appreciate your time. Good luck, and we'll see you next time. Bye-bye.